My name is Amit Dwivedi. I am the Chief of Division of Vascular Surgery and I am with UWell Health. I come from a country which has a very large population and there were a lot of diseases out there. So I think just growing up seeing the poverty and the way people suffered, that was the main reason I tried to become a doctor. Eventually I didn't move to this country, but I think the concept came from that, is seeing a lot of people suffer, and it was always a noble profession from the way I grew up, so I thought this was the way to go. I am a vascular surgeon at University of Louisville, so the patients that we see are patients who have bad vascular disease. Majority of these patients are smokers, diabetics, which is a big population in our state. Unfortunately, they cannot change their characteristics, especially smoking, which is so prevalent. So the patients that we see is buildup of calcium in the blood vessels, which we try to clean, whether it is arterial or venous. And it can range anywhere from the base of the skull to the toe. I think the first thing is being compassionate. That's the biggest thing patients look for, because they're sick when they come to us. So we just being compassionate to them. They may have diseases that cannot be cured, or they may have diseases that may have bad outcomes. But as long as you are compassionate, you understand where the patient comes from, where they are, what is their daily living, or why they do certain things, and then take care of the patient from there. I think those are the key things to take care of patients. Technology is here to help us, it's not to hurt us. So I think the difference that I find in myself at this stage in my career is that I move on quick to new technologies, try to learn it, try to implement it on the patients if the technology is helpful or not. And I have been a leader in a lot of these newer technologies in the state. In certain number of cases, I am the only surgeon who's done those, or I am one of the surgeons who've done the most volume in certain fields. So my whole time usually goes at the end of the day is with my family. Whether it is going out for dinner, whether it is going out for walk, whether it's going out on vacation. Whenever I finish work, I am an avid walker. So I usually walk about 9 to 10 miles a day. And I make it a point that to try to keep in health, at least try to do that much. So my average overall is about 10 miles. So you may call that's my hobby, walking. At the same time, I think during walking, it's a good time. I actually try to do it inside the house, especially during winter when my family is there, so they are all around with me. Now, during summer, I would take my kids on a walk, one after the other, so that they get into the habit of getting physically active too.